The comfortability continues. Now, today's THV This Morning.
All right, we are about a month and a half into the new year. How are those New Year's resolutions holding up? If you've already lost sight of your goal, we want to help you get back on track with our Resolution Revolution. Whether you want to look great in a swimsuit or run a marathon, tell us your goal. And our participants will be guided through the process by personal trainers and nutrition experts from Body Shape Pro Fitness. The Cosmetic Surgery Center of Little Rock will help out by providing a procedure, and the look will be completed with help from Dillard's.
Now, are you interested? Here's what you do. Send a letter with your name, address, phone number, and email to Post Office Box 269, Little Rock, 72203. Be sure to include your age, height, and weight. We'll also need a full body picture. Don't forget to tell us about the goal that you want to achieve.
This is going to be fun to watch. A couple of people try to get back on track and lose that weight they promised they'd lose at the beginning of the year.
Here we're going to do a seated row, right? A little sharp. Yeah, it's a little bit sharp.
Yeah, a traditional box.
Now, your place for community. This is Positively Arkansas with Cheryl Lackey.
We always love to answer viewer questions, and Dr. Rhys Branman with the Cosmetic Surgery Center is back with us this week to answer a lot of them. We had some really good questions for you this time.
That's what I hear.
Yeah, some really good ones. Okay, the first one is a viewer from Hot Springs who asks, my eyes are starting to look tired all of the time. I have bags and dark circles under my eyes that just won't go away no matter how much I rest or how much rest I get. What can I do? What can this viewer do?
Well, I think the first thing is to determine what exactly the problem is. Bags under the eyes can be caused by a number of things, or dark circles can be caused by a number of things. Number one, it could be just pigmentation. And if it's just pigmentation, that's easy to take care of. We can use a bleaching cream and slowly remove that pigmentation, make our eyes look better. If it's from wrinkly eyelids, then we can remove a little bit of excess eyelid skin. Sometimes it's actually from the process of fat herniating out or pooching out from the lower eyelid. And that would involve a lower lid blepharoplasty or removal of that fat.
Okay, and so for this viewer, you would probably have them, you'd probably recommend that they call you.
I would recommend they come in for a consultation. It's not going to cost them anything, and then they'll know exactly what we can do for them.
Yeah, because when you're there face to face, there's a lot more you can see, and yeah.
That's right.
Yeah. Okay, our next question, this is from Sherwood. I've started noticing brown spots on my hands and a few on my face. I've tried the bleaching creams, like what you had mentioned, but they haven't worked.
Okay.
A friend told me about a laser treatment, but the thought just scares me. Can you tell me what is involved in laser treatments? Do you find that people are a little bit fearful of laser treatments?
Yes, and on the hands and for brown spots, it's probably one of the easiest treatments you can do. We use the Silicone laser, and what it does is it targets just the brown spots. And we can remove the brown spots. What will happen is we'll treat the area. The brown spots will get temporarily a little browner, and then they'll flake off within about a few days.
Okay.
And then we may have to do 1 to 3 treatments, but they're very easy. Patients just come in, they get the treatment, they walk out, and they go about their day.
Okay.
It's a very easy treatment.
So if you're in Sherwood, don't be afraid.
Don't be afraid.
Don't be afraid.
It's easy to do.
Yeah, okay. And then the next question, a Positively Arkansas viewer in Mena. We like that one. It's just varied, and they're contacting us from all over the place. But in Mena says, my son has severe acne and some scarring. Is there anything that we can do for him besides antibiotics?
Well, antibiotics initially are important to control the acne, and I think that's the first step. And then once the acne is under control, then you have to look at what you're going to do for the residual scarring. And I think the best procedure out there now still is dermabrasion. It's probably one of the oldest procedures, but I think it's one of the best procedures also.
So you still recommend that for people that
for severe
deal
acne,
with the
yes.
severe acne?
Now, if it's just light acne, then we can actually take a filler material like Restylane or Juvederm and actually fill in those areas and bring them up to the surface, which makes them a lot more smoother.
Does it, I mean, do you want to, because you're talking about they definitely want to do the antibiotics first. So
Right.
depending on their age, I mean, do you want to do those type treatments with someone with acne when they're younger, when they're still in...
Yeah, not if they have a lot of active
growing.
acne. Yeah, if they still have a lot of active acne, it's hard for them to control it, then I wouldn't treat them at that time.
Wait till they're a little bit older.
A little bit older.
Yeah,
Mhm.
okay. A question from Cersei.
Okay.
Is ear surgery only available for adults? Now, we've talked about this in the past, so yeah,
yes.
this is, I really like this. I was very impressed by the work that you guys do. But the rest of her question, my daughter's ears stick out, and we've been able to cover it with her hair somewhat, but she's getting older and more self-conscious. What can we do?
Well, they can come in and get some ear surgery.
Yeah, otoplasty.
Otoplasty.
Yeah.
Yeah. It's a great procedure, can be done very easily. For young children, we usually have them asleep, takes about an hour to an hour and a half. With adults, they can, or even young adults, we can actually do it in the office under some light sedation. Again, it's a great procedure, can be done very quickly and make a dramatic improvement in patients' outlook.
Yeah, with great results. Okay, we have about 15 seconds, but I want to get to this last question. I would have cosmetic surgery in a minute if I could afford it. What are my options?
We've got some great payment programs that are from third-party carriers that will finance your entire surgery, and they make it very easy for you. They can, you know, basically tell you if you qualify right there within an hour.
There you go, and it's really simple. So there are options. So make sure that you contact the Cosmetic Surgery Center with any of your questions, give them a phone call, or check out their website. We'll be back with more Positively Arkansas right after this, so don't go anywhere.
The comfortability continues. Now, today's THV This Morning.
When we return, we'll introduce you to one of our Resolution Revolution participants, talk with her about her goals and her plans to achieve them. Don't go away. During our series Resolution Revolution, you can watch as the Cosmetic Surgery Center, Body Shape Pro Fitness, and today's THV This Morning help two lucky participants revolutionize their New Year's resolutions. This morning, we're joined by Julie Blackwood of Body Shape and Heather Dennis, one of our participants. Thank you guys for being here this morning. Heather walked into the newsroom, I have to tell you guys this, and I thought, that can't be our participant because you're absolutely beautiful, and I can't imagine what you really want to do to change yourself, But you say you want to get in shape. There's some things that you want to get back to your old self, I guess.
Correct. I'd like to tone up and feel good. I want to be confident again. Yeah.
Why did you enter? What attracted you to this particular program?
It's always been a dream of mine just to have a makeover, just to be able to get back fit like I used to be. You know, when me and my husband first got married, I was good. So if I could do that again, if I could just be nice, look nice for my husband, feel good for myself, be a good example for my son, you know, that's what I'm really shooting for.
So you've met with Julie, right? Julie, you've sat down with her. What are the goals here, and are you already started? Have you already started?
No, she has not started yet.
Okay.
What we'd like to do is do probably a metabolism test on her to see where her metabolism is, you know, to find out exactly how many calories she burns a day. Then we could kind of set up a complete diet program for her and a workout program for her and get that set up because she just has not started yet. And then once we get her started on all this fun stuff and get her going so that we could probably a lot of leg exercises and to bring her lower body down some and maybe keep her upper body up some because she tends to gain weight a little more in her lower body and she's a little more lean in her upper body. So we'll try to keep her upper body up and bring down her lower body some.
I know you're really excited about this now. Do you worry about wanting to quit down the road? And what's going to be your motivation, you think?
No, everybody's watching me. I know I've got to do it. That's what I said to begin, before this was even offered. If I had somebody to say, you know, you have to eat this, you have to exercise like this, and, you know, and it's like accountability, you know. If I've got everybody doing that, so many of my friends and family out there, and you guys, I can do it. I can.
Yeah, you live in Greenbrier, work for the Human Development Center?
Correct.
And I know your coworkers also really behind you on this.
They're out there.
Once you meet your goal, what are your plans? I mean, what do you want to come out of all of this? Do you have some bigger goal after you get fit?
After I get fit, I want to continue that course. I want to be able to just say, hey, you know, eating healthy, exercising, that's the way for me. You know, if I can get this into my system, you know, it becomes addictive, and I know that, and that's where I want it to be again. I want to be able to just, you know, like brushing my teeth, get up, exercise.
Just make it routine, absolutely. Now, you've already met with Julie, and you're scheduled to meet with Dr. Devlin from the Cosmetic Surgery Center, correct?
I did speak with him.
Okay.
I did speak with him yesterday, and we talked about some liposuction, and then I'm also scheduled to talk with other doctor, Devlin. Yeah, I talked to Branman yesterday.
Right. Okay.
Yeah. Okay. So I'm anxious to
And
see
how do you
that
feel
goes.
about plastic surgery? Do you have any concerns about that at all?
This area right up here concerns me the most. Yeah, I think that's probably, especially after I lose weight, that might be able to boost my confidence if I could get that fixed.
And really, you're doing this because you want a lifestyle change too. You quit
Definitely.
smoking in
Yes, I did.
2005. That was a great start to a
Right.
healthier lifestyle. And this is really just the progression of that.
Yeah, I'm just ready to be able to be, you know, just a confident person, be able to walk down the street, walk into the store, and not have any, you know, feeling like somebody's looking at me, you know.
Well, we're so glad that you're participating and look forward to watching you, and we're sure that you're going to achieve your goals. We're behind you 100%.
Gonna do it.
All right. So nice to meet you guys. Thanks
You
so much
too.
for coming in.
Just used a little linen.
They make me let go with my.
No advice. It's just another month.
Now, your place for community. This is Positively Arkansas with Cheryl Lackey.
During the summer months, we all want our legs to look their very best, don't we? One option for that is liposuction. Dr. Rhys Branman of Cosmetic Surgery Center is here to talk with us about this popular summer procedure. I am curious at just how many more of these procedures that you do during the summer months or heading into the summer months.
Well, heading into the summer months is our busiest time of year. Actually, we do a lot of these procedures. We really do.
What kind of increase would you say percentage-wise? How many more?
Well, I would say that we probably have a 50% increase in the number of people that are getting these summer-type procedures like liposuction.
Wow, that's amazing.
It is amazing because everybody's thinking, oh my God, the summer's coming. I've got a little bulge here. I've been exercising. I really want to get rid of it. Maybe Dr. Branman can help me out.
Yeah. Now, are there different, we've talked with you about some of this before, but are there different types of, I don't think they're all called liposuction, but different types of these procedures, liposuction type procedures that you perform?
There's basically different forms of liposuction. You can do liposuction alone, where you place a small cannula under the skin and take out the fat. You can also use devices like ultrasonic liposuction, where you go in and break up the fat first and then take the fat out. And I think those are two very, useful ways of removing fat. There's also ways of just doing it with very tiny micro cannulas for very small areas like under the chin, where people can come in, get the liposuction done, and they can be back at work within about 2 days.
Yeah, because I think people think about liposuction, they relate that to the legs, but this is a procedure that you can do on other parts of the body.
Oh, sure, you can do it on every part of the body that has fat. And so we do it on the face. Some people, we do it on the cheeks. We also can do it on the breast area for large breasts, the hips, waist, flank, really pretty much everywhere there's fat we can do liposuction.
Now, when somebody comes in, they do the initial consultation with you, they have the procedure done, they decide which one, you talk with them about some of these different procedures, decide what is best for them. How long from beginning to the end of the process till they see the changes in their body, whether it be their legs or face or what have you?
Well, after we do the consult and actually do the surgery, typically there's some swelling for a couple of weeks. Once that swelling goes away, people start seeing results immediately. And so what they'll find is that within a few weeks they're seeing the big changes that they wanted to see, especially in the legs and the hips, where this change is really almost immediate.
Yeah. Well,
It really is amazing.
let's go ahead and look at some pictures, and we just, you know, with these type pictures, I think it goes without saying,
Sure.
but obviously we need to show the body to show the before and the after.
I
So,
understand.
but tell us a little bit about what happened here.
This is a patient who had a fairly large abdomen, and you can see in the left side the abdomen is hanging over the garment there. And then after liposuction, we removed that. All that area that was hanging over is now retracted in, and now we have a much slimmer abdomen. I mean, obviously she isn't, you know,
Petite.
but you can tell that she's actually removed all that area that was just hanging over. And you'd think that you'd have a lot of loose skin after something like
Yeah.
that. And actually you don't. The skin actually retracts very nicely.
Now, with someone that maybe is a little bit bigger, do you, I mean, is that part of the thing that you counsel with them on, okay, maybe you need to lose a little bit more weight before we do this, or is it kind of a, yeah,
Most
okay.
definitely. If someone,
Yeah.
you know, I want people to be their, not necessarily their ideal body weight, but at a weight that they can maintain. If they're fluctuating weight up and down, we don't want that. That's going to hurt our procedure. And so, really, we want them at a point where they can actually maintain a certain weight, not gain weight, and then we can go ahead and do the procedure.
Yeah, go ahead and stabilize. Now, I wanted to go back to that picture there because that was of the legs. I mean, you can
Sure.
clearly see the difference.
Oh, and this person is an ideal person for liposuction because you can see they've just got what we call the saddlebag area, and it's just a bulge on the side of the leg. We can almost do this procedure with local anesthetic. The person could almost be awake doing this procedure if we wanted to. We would numb them up with a little local anesthetic and then go ahead through a very tiny couple of millimeter incision, which you can't even see here. We would remove that fat, and then they would see results almost immediately. And if you look carefully, you can see that we actually took out fat from the sides, the outer leg, as well as the inner leg. And what it does is it gives a nice slimmer, thinner looking leg. And this person, within a week, was back doing whatever they wanted to do.
Normal activities. Oh,
Yep.
that's really good. Well, if you have any questions for the Cosmetic Surgery Center, you do see that email right there that is up on the lower part of your screen. And also, if you want to go by and visit them, give them a call, set up a consultation, there's information for you right there. They are at the on Executive Center Drive here in Little Rock. And they have a really great website, too, where you can gather more information before you even make that first call, so that you can be prepared and know the questions you want to ask. We will be back with more Positively Arkansas right after this.
Just used a little linen.
That, oh yeah.
They make me let go with my
No advice, it's just another moss.
Now, your place for community. This is Positively Arkansas with Cheryl Lackey.
Have you noticed your eyelids getting puffier and staying that way, or you may have more wrinkling around your eyes? We all experience it as we age. Dr. Rhys Branman with Cosmetic Surgery Center joins us this morning to show us a procedure that can improve the look of your eyes. Now, this is called blepharoplasty.
You got it.
All right.
Blepharoplasty.
And it's reshaping the eyelid.
It is reshaping the eyelid, and it involves reshaping the upper eyelid as well as the lower eyelid. Both the upper and lower eyelid, you know, get a little saggier as we get older. Sometimes through straining at looking at sun and just wind damage, sun damage, the eyes and eyelids can get a lot worse looking. And so what blepharoplasty does is it removes excess eyelid skin, muscle, and sometimes people get a little bit of fat that comes out that herniates. We call it herniating. It just pooches out a little bit, and we remove that also. And it can really do some dramatic changes and make someone look a lot younger and a lot more rested. If you think about it, when you look at someone, you're really looking at their eyes initially, and then you sort of pan the rest of the face. And so that really makes a huge difference when we just do eyelid surgery.
Is this something, I guess this could be something that could it be genetic too? Maybe your eyes are just puffier that way? I mean, we talk about aging that you do see as people age.
Sure, it definitely could be genetic, and you can see that in, you sort of have a similar features that your mother or your father might have, and you know, people will get aging and loss of, you know, or loss of tone to the eyelids, and so this is a nice procedure that in many times can be done with just some light sedation in an office type setting, in a very safe setting like that, and we can do those procedures, and within an hour you can have new eyelids.
So this is an outpatient
It's
procedure.
definitely an outpatient procedure.
An hour.
You can have new eyelids in an hour.
Wow, that is amazing. Well, let's go ahead and take a look at some of the pictures that you sent over.
Sure.
So that we can give our viewers a better idea.
Yes, and you can see here that this, especially on the side profile view, you can see that this patient had a lot of excess skin hanging over their upper eyelids.
Yeah.
And by removing that, they just have a brighter look to their face.
Yeah, very much so.
And that's what's really exciting about this procedure. Instead of looking like they've got this excess, tired look to their face, they've actually got this brighter, happier look. And I think that's the key to blepharoplasty. It really is a nice, rejuvenating procedure.
Well, her eyes are so much more open.
That's right.
And more even, I mean, not that she's not probably a friendly person, but just even a friendlier
That's right.
Look.
And and if you think about it, the difference is, 10 to 15 years.
Yeah.
Just
absolutely.
in the eyes alone.
Yeah. And I think we have another set of pictures. Yes, we do.
Here's another set where everything looks kind of drooping and everything looks like it's sagging. And probably with this patient, she also had a brow lift. And I think that you need to also take that into consideration, because if you think of the upper eyelid and the brow, they're both together. And many times patients have not only drooping or excess eyelid skin, they also have drooping of the eyebrows too. And many times we'll do these procedures in combination.
And all of those type questions are the ones that are great to ask when you go in for an initial consultation, because all of your patients come in for an initial consultation.
Of course they do.
It's very important to
No,
do that.
we would never see a patient without a first initial consultation.
Because they've got to have those questions too in their minds answered, and we've talked about this before, but having the realistic expectations and going over the different procedures and
we
giving
want them
an idea.
and we really want them to know what we're planning on doing, where the incision sites will be. We also want them to show us what they don't like about themselves.
Yeah.
And in doing that, that allows me personally to then really see what I can do for them and make the changes they want to have done.
Yeah. Now, with that lady that we had looked at, you said she had the eyebrow lift as well, and
Sure.
the blepharoplasty.
Blepharoplasty.
For all of those procedures, how long then did that take? Was the eyebrow lift, was that an outpatient? Is that an outpatient
Depending on the
procedure?
type of eyebrow lift we do, it can be.
Okay, it can be.
It can take about an hour and a half to 2 hours for both the brow lift and the upper eyelid surgery.
And for complete healing to where they're back to normal and everything?
I would say about 12 days they should be able to get out and about and wear a little makeup and cover things up, because pretty much all the incisions are hidden either within the eyelid fold or up in the hairline.
Yeah. Well, you've been seeing that email there across the lower third of your screen. You can send your questions to Dr. Branman, to the Cosmetic Surgery Center, and they will be happy to answer any of those questions that you have for them. You can also call them for, as we discussed, an initial consultation. You want to make sure that you do that. And there is all that information that you see there on your screen. They have an absolutely excellent website, too, where you can gather more information. We will be back with more Positively Arkansas right after this. Thank you, Dr. Branman.
Thank you.
Just used a little linen.
They make me let go with my
No advice, it's just another moss.
Now, your place for community. This is Positively Arkansas with Cheryl Lackey.
Breast augmentation ranks as the third most popular cosmetic surgery. If you're considering breast augmentation, you want to make sure you fully understand what's involved in the surgery and have realistic expectations. Dr. Rhys Branman with Cosmetic Surgery Center of Little Rock is here to discuss the most often asked questions. So really, that is my first question to you. When you have that initial consultation with a patient, what is the number one question that you get usually concerning breast augmentation?
How big am I going to be?
Yeah.
And how are you going to ensure that I get the size that I want to be?
And then when that question is asked, how do you answer that? Because it really just, you want to be realistic.
I am realistic, and to a certain extent we want to get an idea of what size they want to be. And so what we say is, what size of a cup size do you want to be?
Yeah.
B, C, D, double D, whatever it is. And then we go from there. Sometimes people are limited to how big they can be just by the size they are. Very petite or very thin women can only be a certain size. They may only get to be a C. They may not be able to get to a D size.
Yeah, and sometimes too, I mean, a lot of times women just come in because they simply want larger breasts, just
That's right.
being realistic. But also there are women who maybe they've had children or maybe they've had weight loss, you know, different things like that too, that they would be coming in and speaking to you about breast augmentation.
You're absolutely right. And the two biggest groups that we see coming in are women that are a little bit younger, maybe in their mid-20s, who want to be larger. And then we see another group of people who are women who have had children, and they just want their breasts to be back to the size that they originally were.
Yeah, yeah. Well, let's go ahead and take a look at some pictures, and we did our best to make them viewer-friendly, but just to warn you. So,
Sure.
Now tell us a little, I mean, you can clearly see just this person was definitely flatter chested before
That's right.
the
This
procedure.
is a younger woman who wanted to go with just a larger breast size. She was originally an A size cup, and then she went to a C cup. We actually put in silicone implants on her as opposed to the saline implants, and they have a much more natural look to them, and I think more and more women are actually deciding to go with the silicone implants just because they have a more natural feel, and they just get a more natural result to them.
Yeah. Do you ever have, I mean, I'm sure you offer them here are the options so that they
Sure.
can decide, but you do find that people are choosing that more and more, and there are more studies that are coming out
That's
and
right.
continuous studies to
That's
make sure
right.
that they're safe.
Well, what we do is we offer the whole range of implants to our patients, from the manufacturer types to the size to the style and to the what's in the implant. So there's just a very large number of things or factors that come into play when we choose implants for patients.
Yeah. For the picture that we just saw right there, the silicone breast implant, how long do breast implants last typically?
Well, that's a good question. I've seen silicone implants lasting 20 years or more. The manufacturers state that they're not a lifetime implant, which means that somewhere down the line you'll have to get them changed out. But we've seen them last as long as 20, 25 years, and I think, although you can't necessarily expect that.
Yeah, okay, well that's longer than I thought that, yeah, they would. Now we have one more picture.
And this is a young gal who went with a saline implant. Again, she's
So she went with saline?
yeah,
Okay.
a relatively thinner gal. You can see that she doesn't have a lot of breast tissue to begin with, and she's a C also. And I think that's a good size for her, and it looks very natural on her.
Yeah, it does look pretty
We're
natural.
not trying to, you know, produce showgirls or things like this. We're trying to put implants in that is going to fit well with the person's body and look natural with them. And I think that's the ultimate goal, and that's what patients, you know, typically want.
Now, when you have the breast augmentation done, how long till there's complete recovery and you're back to your normal daily routine?
4 weeks. And after 4 weeks, we tell people they can just go back to whatever they want to do.
Yeah, and so I guess during that time, I mean, there is some time off of work that you need to plan for.
Typically, patients are off for maybe a week or a little bit less.
Yeah. Okay. So 4 weeks. Okay. Well, I'm sure when we do segments like this as well with any of the segments we do with the Cosmetic Surgery Center, you're probably thinking about questions that you have in your head. So we have that email that we leave up there on the lower third of your screen. You can also contact the Cosmetic Surgery Center directly at one of those phone numbers that you see right there to set up a consultation for yourself, and you can check out their website as well because they have really great information there for you too. Thank you so much, Dr. Branman, for your
You're
time.
welcome. Thanks for having me.
We'll be back right after this.
Just used a little linen.
They make me let go with my
No advice, it's just another moss.
Now, your place for community. This is Positively Arkansas with Cheryl Lackey.
It may be the nose you were born with, but if you're not happy with it, the cosmetic procedure rhinoplasty, common called a nose job, may be an option for you. Dr. Rhys Branman with the Cosmetic Surgery Center is with us this morning to tell us more about this procedure and who's a good candidate for it. So when people come in to talk with you about a nose job,
Sure.
What is the most common complaint that you hear from them of why they want to go ahead and they want their nose to look different?
My nose is too big.
That your nose is too big?
That's the most common complaint. Either I got too big of a bump, or my nose is too wide at the tip,
Yeah.
looks too bulbous. And we Those are the two most common complaints.
Now, is this a procedure that can be done at any age?
I wouldn't say any age, but I would say young adults, young teenagers who have completed their growth cycle can have a nose job also. It's one of the few procedures that I would do on a younger person because it makes such a big difference in their outlook and the way they're seen by their peers that I think psychologically it makes a big, big difference. And so that is one of the two procedures that I would do on a young person.
Yeah. Now, I know rhinoplasty is also used for, I mean, we're talking about cosmetic surgery, but for people that maybe have nasal obstructions or people who have potentially had some kind of facial injury.
That's right. And many times, part of the problem with the nose is that the septum or the midline of the nose is deviated or off to the right or the left. And that makes the nose look crooked. And that can also affect the way a person breathes through their nose. And so when we correct that septum or that midline deviation, that does two things. It makes the nose look better, and it also corrects the breathing problem.
Yeah, and so not real young. I mean, you usually want them to be in their
usually in their
growing
teens,
state,
16, somewhere around that time.
Well, let's take a look at some pictures, and you can tell us a little bit about the procedure itself and what you did.
Well, here's a gal who had a wide nose on the left side, upper left side. You can see that.
How old is this person?
She's in her 20s.
Okay.
She had a widened nose. The whole base of the nose looks pretty wide, as well as the bridge of the nose. And if you look on the profile, we took that bump down and also made her tip a little bit smaller. I think that makes a nice change for her, really does.
She's got that cute little rounded kind of nose.
That's right.
Yeah, on that bottom. Now, when you did this procedure for her, how long did this procedure take?
The procedure takes about a couple hours.
Okay. Is it inpatient or?
They won't stay overnight. But they will be asleep, and it's done with the patient completely asleep. So I wouldn't do it in my office.
Okay, okay. Now we've got, I think, one more set of pictures. There you go.
Yeah, it's a young gal who also had a slightly widened tip and base to her nose. And we took down the tip and made it a little daintier. We also made the bridge a little more narrow, and you can see just these small refinements in the nose really change the way someone looks, and it really gives a refined look to the patient. This patient probably took about another hour and a half, and really within about 3 weeks she was back to doing whatever she wanted to do.
Yeah, you had mentioned about how it really can change a person's I mean, obviously it changes their appearance, but just their self-worth.
Oh, their self-esteem and their outlook on life. It really does change the way they look at things. They don't feel like people are staring at this part of their face. And our goal is to make it so that the nose blends in with the rest of the face and isn't something that just sort of stands out anymore. Yeah, and this is, okay, so it's a procedure that you do probably all together in like half a day, but you would do it at the hospital is what you said. We do it at the hospital. Okay. With the patient asleep, usually takes a couple hours. Okay. And then they have a little splint on that stays on their nose for about 5 days, and then that comes off, and they're back to doing whatever they want to do. Okay, so they take probably a little bit of time off work unless they don't mind walking around with the splint. Right. Yeah. Exactly. And then they're back up normal activities within how normal activities. I say normal activities in 6 weeks because the nasal bones typically are still healing. Because they're not going to be wanting to do a lot of running around. No, we don't want them. We always say avoid kid heads and dog heads because sometimes they bump, little elbows and things like that can bump your nose, and we don't want that happening for about 6 weeks. Yeah, so kind of lay low there for a while and don't do a lot of extraneous activities. Well, you see that email right there on your screen. Make sure that you do send along any questions that you have to us, and you may see that on a future segment. And you can also contact the Cosmetic Surgery Center. We have a couple of phone numbers for you right there if you are here in Little Rock, or if you're in the area, we've got that 1-800 number for you as well. And as I always like to plug their website, they have an excellent website where you can find more information too. We'll be back with more Positively Arkansas right after this, so don't go anywhere.
Just used a little linen.
They make me let go with my...
No advice, it's just a lost down.
Now, your place for community. This is Positively Arkansas with Cheryl Lackey.
Botox injections are the fastest growing cosmetic procedure in the industry. Dr. Rhys Branman of the Cosmetic Surgery Center of Little Rock joins us with more on how you can smooth out those frown lines. And really Botox does a lot. I mean, it does more than just smooth out the frown lines, but that's probably a big reason why people come in and get the Botox
That
injections.
is a big reason why they come to get it. And it does a lot more than, it's used for many things in the medical industry, but the primary use is for smoothing out lines of the forehead, around the eyes, and even some lines around the mouth. It's a great product. It has an excellent safety record. It's been used since the early 90s. And so I'm very, very happy with this. This is one of the better products that are out there in cosmetic surgery.
Well, and you see the consistent results, don't you?
You do. And if someone doesn't like the results, it's gone in about 4 months. And so there really isn't any long-term bad results that can occur from Botox.
Yeah, and I was going to ask you about that, just different studies. Are there any, I'm sure there are different studies, some studies out that show, like you said, this has been around since the early 90s?
Since the early 90s.
And just what the studies may show about the, you know, long-term effects or the lasting results, that kind of thing?
You know, the studies out there don't really show that there are any long-term, lasting, bad things that are going on with Botox. Even though it is what we call a poison, it's not, it doesn't have any long-term bad effects, and that's the nice thing about it.
Yeah, and this is probably more a scientific question, but it amazes me how it can be something that is, isn't it actually, I mean, what is Botox? What is it made of?
It is actually a neurotoxin that comes from a bacteria, but it's a purified protein that is injected, and what it does is it prevents the nerve from firing, and what that does then essentially is paralyze the muscles where we inject it.
So see, it just amazes me they can take something like that and then it can actually have a cosmetic positive result to your appearance.
It's amazing. It was originally founded by people who were using it for people who had what we call spasms around their eyes, where they couldn't even open their eyes. And then they sort of found, hey, well, the wrinkles went away too. And they started using it for wrinkle control and things like that.
Well, we all, it's that whole thing, we all want that more youthful look.
And this is an easy way to do it, because you can come in the office, get it done, walk out, a couple of days later it's taking effect. There's no downtime.
Well, we have a picture of a before and after of a patient, and she can attest to the, you know, that yes, it doesn't take very long and it does make a major difference.
Yeah, and you can see right between her eyes, that big frown line there. This is the typical area that people put Botox. She has now a much more relaxed look, not frowning, and I think that's what people really are looking for.
So when she or when a patient would come in, do they get it? Is it a series of injections that she had that you would get for this result?
Actually, it would be one session. We do about 5 injections in between the eyes, and then that's it. And they're ready to go for the next 4 months.
So they're in and out of your office in, what, under an hour?
Oh, easily.
Less than that?
15, 20 minutes.
And just go back to work?
That's right.
And then don't come back and see you for 4 months?
That's right.
Yeah, I'm sure you can, we've heard this, you can get too much Botox.
You can, and if it's placed in the wrong places, you can't have problems with it. That's why you want to go to a physician that is experienced with it, that does it all the time, and isn't doing these sort of little, I do it once a month kind of thing. You really want to go to some place that's doing it all the time.
Yeah, somebody that is well trained and it's almost second nature, if you will.
I agree.
Yeah, that you guys really know what you're doing. There are a lot of different products on the market. I mean, there's what, Restylane, there's a picture right there.
Yes.
And people can get kind of confused as to what these are versus what Botox is.
Right, and all these products that you see up on the screen there are filler materials, and so they don't paralyze the muscle. What they do is they'll fill in a line. And so if you have a line on your face or cheek, what this will do is this will actually puff it up and make it less noticeable, while the Botox actually is directed at the muscle that's causing the line. And that's the difference between these type of things.
Okay, and do you guys work with those other products too?
We do. We work
yeah,
with all of them, and they're great products, and there's a whole series of them out there, and all the ones that you saw up there, we have them in our office. And they all do different things, and that's what's kind of wonderful about it.
Yeah, which is why it's really good to just go ahead and call you guys and set up a consultation.
That's right.
And say, okay, I've got some areas of the face and I have some questions, and what is the best route for me to take? So make sure that you do contact the Cosmetic Surgery Center. There's a couple of phone numbers there on the screen for you, and you can also go to their website and find out more information as well. Dr. Branman, thank you so much for being with us
Thanks for having me. It was great.
Okay. We'll be right back.
just used a little linen.
Oh yeah.
They make me let go with my.
No advice, it's just another moss.
Now, your place for community. This is Positively Arkansas with Cheryl Lackey.
People of all ages are seeking surgical procedures like facelifts. Reports have shown even people, this is going to amaze you, as old as 80 years old are hoping to benefit from this cosmetic procedure. Dr. Rhys Branman of the Cosmetic Surgery Center of Little Rock is with us to talk about this popular surgery. Have you had somebody in that's that
Pretty
age?
close.
Really?
Actually, we've had someone who's 81.
Really? So this is not something, it used to be reserved for the older people, but it's something that not only is the older people, but we're seeing just a wide age range
We are.
now.
We're seeing a range from 40s up to, as you just said, 80s.
And for that person that was 81, what kind of improvement were they looking for?
They had a lot of excess skin around their neck, under their chin, and it's just sort of sagging skin. They just wanted that gone.
Yeah.
They're a very healthy 81-year-old,
Yeah.
very active, and they didn't want to look 81.
How long do the benefits of a facelift last?
Typically about 7 years.
Okay, 7 years. Now you had said 40 to 80, that's your typical age range of the patients you see. I've read where people now even in their 30s are doing that just to try and kind of stay ahead of the game, so to speak.
Yes, but there are very, very few people that are in their 30s that really need a facelift or would really benefit that. I think that's pushing the envelope a little bit.
Yeah.
I think mid-40s up to the 80s, I think that's a pretty good range.
If someone came in and they were younger, would that be one of those, you know, you'd have that consultation and you may encourage them, you know, I really don't know that this is the best thing for you at this time?
Yeah, I probably would, and we would look at them specifically and see if there are other things that we can do that would help them along, and so that, you know, ultimately they can get a facelift maybe 10 years later.
Yeah. Well, you have several before and after pictures, and so we want to go ahead and get to these.
Sure. Let's look at it.
And see tell us a little bit about this woman right here.
Yeah, if you kind of look at her lower neck area, she had this excess fat under her neck, and she went through we call it a smart lift, a facelift procedure, and brought everything up and back, and you can see it just very much cleaned up that whole area under her neck there and gave her a much smoother and more youthful look to her face.
Yeah. Well, because facelifts really aren't a treatment for wrinkles per se, but it can help definitely in that aging effect.
That's right. And here you can see this is another woman who had some excess skin under her neck, and also the jowl area. If you look at sort of that jowl that was just kind of hanging down there. And really, with the facelift procedure, you can see a much more youthful look. We also put a little bit of fat in her cheeks, and that kind of gave her a little more fullness there, and that really made a nice change for her, too.
Because when people come in for now they think this is a side shot of that first woman that we looked at.
It is.
But when people come in for a facelift, sometimes that's the opportune time, too, to consider other things that may complement that facelift.
And many times we'll do multiple procedures at the same time because it's more time effective, and it allows us to sort of rejuvenate the entire face. So for example, we may do upper and lower eyelids, a brow lift, as well as the facelift.
Yeah, and go ahead and do that all at once so you're not making a series of
Procedures,
trips and
that's right.
procedures, yeah.
Yep.
Now, for this woman, boy, that's a big difference.
It is a big difference, and she had a lot of fullness under her neck as well as the jowling. And what we'll do in this case is, in addition to the facelift, what we'll do is we'll do some liposuction under the neck and get rid of that excess fat, and that will allow us to bring that skin up a little bit tighter and give her a much nicer neckline.
Well, and she has a chin now.
That's right. Because
Yeah.
there's not that fat there hiding it.
Yeah, and that's the front.
And that's the front.
Right, of
and so you
that.
really see, it almost makes the face look fuller, which is a more youthful look. And I think that's what's very nice about the facelift procedure.
Well, I know there's variations of facelifts. So if you're someone that's contemplating this, how do you go about deciding, okay, what's going to be best for me?
As a person,
Yeah.
well, you really have to come in and do a consultation
Yeah.
and really get an idea from someone who's going to look at you, number one, and listen to your desires. And then we can decide what exactly that you want to have done. or what needs to be done.
Well, really kind of, I mean, you take that place of just walking through the process with them and saying, okay, here are the options, listening to what they say they want. Okay, I think I would recommend this for you. And then you have to make those decisions.
That's right, because what we'll do is we'll look at what they want and what they bring to us in terms of their facial structure, and then make a decision about exactly what will accomplish their goals.
Well, there is the information right there on your screen. Make sure that you do contact the Cosmetic Surgery Center for more information. Thank you so much, Dr. Branman.
Thank you for having me.
Okay, we'll be right back.
Just used a little linen.
Oh, yeah.
They make me let go with my.
No advice, it's just another monster.
Now, your place for community. This is Positively Arkansas with Cheryl Lackey.
Breast augmentation ranks as the third most popular cosmetic surgery. Dr. Rhys Branman of Cosmetic Surgery Center of Little Rock is with us this morning to talk about the expectations and answer some of the most often asked questions. We were just having a conversation about this in our office of the number of people that we know who have had breast augmentation of some kind. It seems like it really is the third most popular surgery.
Yes, it is.
Yeah.
It's very popular.
Yeah. When people come in to see you, aside from the obvious that maybe they want a larger chest, what are some of the reasons that they give you for wanting breast augmentation?
Well, I think there are two main reasons that we see. Number one is it's women who really don't have a lot of breast tissue and they want to be larger. And then there's another group that used to have breast tissue and for various reasons, maybe weight loss or they had children, and then they want to get back to where they started. And I think these two groups really comprise the largest majority of people who are getting breast augmentation.
Is this something when I was thinking about the numbers, the third most popular surgery, do you find that to be pretty common for you at the Cosmetic Surgery Center, that it's one of your top?
Yes, it's very common. We're doing breast augmentations every week.
Yeah.
Multiple patients every week.
What about this in comparison to the other type surgeries that you do, whether it might be Lipo Selection or facelifts or that kind of thing? How does it compare?
I think they're probably 30% of our practice is breast augmentation. It's a very, very popular procedure and relatively safe procedure, and so people get, routinely very good results, and so that's why people are doing more and more of these.
Yeah, well, I know through the years, there's been different reports and there's been caution and then, there, all of the different things. So when people come in, I'm sure that you still get a lot of those type questions.
Of course we do, and that's why we sit down and spend a good hour or more with patients and discuss breast augmentation, all their options, saline-filled implants versus silicone-filled implants, whether they want to go under the muscle or on top of the muscle. These are many of the questions that people ask, and we spend a lot of time going over these things with them.
Yeah. Now, do you do, because we think about this in cosmetic surgery, and this is something that someone is making that choice. Do you ever, I'm just curious because I don't know, do you work with people who maybe have had, whether it be breast cancer or something like that, and they need the reconstruction?
Typically,
do you do any of that?
Typically we don't. What we'll do is we don't do the reconstructive side of surgery, we do more the cosmetic side of surgery.
Yeah, you focus on that.
That's right.
Well, we have a few pictures, and we do want to just let our viewers know, just before we go to them, that we've tried to be as discretionary as possible.
Sure.
But this is talking about the breasts. So here you go. You can tell us what you did here.
Yeah, this is a submuscular breast implant. We put about a 350 cc implant in, and the incision was made under the breast, and so you can't see it at all with this type of procedure, and you can see the nice fullness that is obtained with a standard breast augmentation.
Now, is this silicone implants or?
These were silicone implants, and so it has a very natural look to it. The silicone implants tend to be a lot more natural looking, and they also have a much more natural texture to them than the saline implants.
Now, for the procedure for this breast augmentation, how long did that entire procedure take?
That entire procedure, the actual surgical procedure, took about 45 minutes.
Really? 45 minutes. And then the recovery process for that patient?
The recovery process for that patient will be somewhere around the area of about a week.
Okay. Now, rapid recovery is also something that we have discussed, actually answered it, I think, on a past show. Someone had the question of the differences. And you put them actually through, I mean, this involves a series of exercises.
Arm exercises that start right in the recovery room, and they continue throughout the recovery period for the patient. And what we're finding is that these patients recover quicker. I've even had, and this is actually what you're seeing here, is the arm exercises that we're showing that the patients do. They sort of put their arms out, and then they raise them up, and then they put them over their head. And what this does is it relaxes that muscle where the breast implant's sitting, and it allows the patient to recover much quicker. I've had patients go shopping the same day as the day of their surgery.
And so they're doing these exercises on a continual basis for for a certain amount, a specified amount of time, specified by you as the doctor.
Exactly.
Okay, and that just helps the recovery process so much more.
Well, we've had just phenomenal success with this.
Well, if you want to find out more information about anything that we've been talking about here today, make sure that you do contact the Cosmetic Surgery Center at one of those phone numbers that you see right there on your screen. Dr. Branman, thank you for being with us.
Thanks for having me.
Okay, you have a good afternoon.
Okay, I will.
We'll be right back.
Just used a little linen.
They make me let go with my.
No advice, it's just another moss.
Now, your place for community. This is Positively Arkansas with Cheryl Lackey.
Liposuction was first introduced in the United States in the early 1980s. I think that's correct. It's a popular procedure that removes those stubborn fat deposits. Dr. Rhys Branman of the Cosmetic Surgery Center of Little Rock is here to talk with us about how to remove unwanted fat. Now, I looked at you because I know we've had past conversations about this. It was introduced in the early 1980s.
That's right.
Became probably more popular
mid-80s to early 90s, and then just exploded from there.
Yeah, and then of course now one of the newer techniques is Lipo Selection.
That's right.
As we just keep going forward.
We keep getting better.
Yeah.
And I think what we're doing now is we're getting better with smaller cannulas, smaller little tubes that take the fat out, and we're selectively breaking up the fat so that it's easier to get, and it's causing less swelling, less bruising, and a shorter recovery time. And I think that's what's great about the Lipo Selection procedure.
Yeah, and that's something, Lipo Selection has been around for how long?
Really in one form or the other since the mid-90s, but really just within the last few years has it become safe enough so that we're not seeing any problems with it. So I think now the technology has sort of reached the pinnacle where now we can really do it safely and effectively.
Yeah, well, it's one of those things, you know, those unwanted fat deposits. It's an ugly truth, if you will, for women and for some men as well.
That's right. For women, we tend to take off the areas from the stomach and the saddlebag area. For men, it tends to be right around the abdomen, waist, flank area. And I think, but every area really is amenable to liposuction. We do liposuction on the face, we do it on the arms, we do it on the back, the legs, knees, really pretty much anywhere you have fat, we can do liposuction and get rid of it.
If somebody comes in then and is it somewhat normal that they might get it removed from several areas of their body?
Yeah, it's very normal. What we have is what we call a volume limitation. We don't take more than a certain amount because that's sort of the safe threshold for removing fat. But if you have a number of different areas that have fat and you don't meet that threshold of volume, then we can take out from any area you want.
Mm-hmm. And for whether it's liposuction or Lipo Selection, if you have this procedure done, how long is that going to, the effects of that, how long is that going to last? And I guess some of it would partly depend on you.
Well, the effects
of it. As in you, the patient.
The fat is removed and it's permanently gone. And as long as you don't gain weight, it's going to last forever.
Yeah, which is that part I'm saying, where part of that comes on the patient.
That's right. What we tell people is we want them to be at a weight that they can maintain and not be fluctuating their weight up or down. And I think it makes a big difference, and really we see very nice results on a long-term basis.
Mm-hmm. And so they need to continue that lifestyle even after they get the procedure done.
Yeah, because it doesn't make any sense. What can happen is if you gain a lot of weight after liposuction, you can gain weight in areas that you normally don't get fat. And then that looks a little odd.
So the fat will be deposited differently. Yeah.
That's correct.
Yeah. Well, let's go ahead and look at, we have a couple of before and afters. And the first one, this is actually of a gentleman. We mentioned that you are seeing more men come in for
We're seeing
liposuction and lipo selection.
Very recently, we've seen a lot more men coming in, and this is a gentleman where we did his abdomen, waist, flank area, and you can see he's sort of got now a really defined waist area. Even the chest and the abdominals are more defined. You can see them better through the skin. I think it makes a very nice change.
Okay, and I think we have one of a woman, yes.
Yes, and here this is a typical woman who's got some saddlebags as well as the fullness in the abdomen, and you can see we've just smoothed out that lateral thigh area, given her much more defined leg shape, and smoothed out her abdomen quite nicely.
And so for her, you know, keeping those legs the way that they look very nice there after the procedure, you know, it's one of those things, people, you don't go back to eating the chips and the ice cream all the time and all those kind of things, and maintain an exercise program so that you can maintain that look.
That's right.
Yeah.
You're absolutely right.
Yeah. Are there any, can there ever be any complications
Well,
in this procedure?
with any surgery procedure, there are possible complications. Pain, bleeding, swelling, infection, these are common. You can get some little lumps and bumps that need to be corrected. But for the most part, liposuction is a very safe procedure, especially in the hands of someone who's been doing it frequently.
Yeah, which you guys definitely have.
We do it all the time.
Yeah, between you and Dr. Devlin, you have a lot of experience
That's
between
right.
the two of you. Well, if you want to contact the Cosmetic Surgery Center, you really should. They will be happy to set up a consultation for you. You can call either one of those phone numbers that you see right there on the screen, or you can check out their website as well. We will be right back with more Positively Arkansas, so don't go anywhere.